by Professor Mark Brincat, who held the position of Director of the Department of Obstetrics for 27 years. He's also Professor of Obstetrics and Gynecology at the University of Malta and Queen Mary, University of London. We will be addressing today the precautions that need to be taken during pregnancy. We've seen last week a new local case of coronavirus that was reported of a 36-year-old pregnant Italian woman who contracted the illness locally. A few days ago, a 55-year-old midwife in the UK also died of coronavirus, and that obviously affects women who are going for their pregnancy checkups. Carrie Symonds, the partner of the British Prime Minister Boris Johnson, is pregnant, and she must also be going through some trauma while recovering from the virus. What precautions are taken to protect contamination to expectant mothers and the newborn child? And I turn over to speak with Professor Mark Brincat. Thank you very much for joining us.
Hi, good evening, Leah. I hope I'm coming over clear. And I think firstly, the basic message is one of relative reassurance, because after having studied the case in China, there's very little evidence that the virus is transmitted to the baby directly once a woman is infected. Now, it's still early days, and there is a bit of evidence to the contrary. But the majority of cases do indicate that in fact the virus is not transmitted to the baby directly or to breast milk. Now, a pregnant woman, like any other woman, can get the infection. We are obviously worried when there's a high temperature running. These women are young, they tend to be young. However, they tend to be immunocompromised because they are pregnant. So you've got a bit of swing and roundabouts here. Now, the general advice is for people to carry on with their antenatal care as usual. There are two documents that we rely on. One is the Royal College one, which Boris Johnson's fiancée has been studying. She said that she's been referring to it, actually. And it's available online. It's the Royal College of Obstetricians and Gynecologists in the UK. And our advice is very similar to it. We heard the chairman of the current chairman of Obstetrics and Gynecology speaking this morning, and his advice was more or less the same. And the first is to keep your antenatal visits either to Malta Day or to your doctor, wherever, but to neither, because these have been designed over a number of years to be appropriate for the best care of the mother and her baby, to be alert for any signs of temperature, sore throat, and so on. And as I said earlier, to have plans to proceed as usual with your pregnancy. Now, I know that Malta Day has sectioned off part of its labour ward of the delivery suite to look after potential patients with who have got the COVID-19 virus. And this in itself is not an indication for a cesarean section, for example. You know, if they're going to deliver normally, they can still deliver normally. Wait for the onset of labor. The midwives should, of course, in the positive cases, be wearing the full PPEs, their protective clothing, and that's the best care that we can give in an isolated situation. There are these guidelines which have to be adhered to. Women being admitted for induction or for cesarean section will be tested, even if they are asymptomatic. We know that there's quite a large number of asymptomatic cases out there, women who've got the COVID virus, but who are asymptomatic. And we also know that the way this virus is behaving is that you've got a large number of infections. Most of them are mild. Most of them are like flu-like illnesses, but there is a small percentage who will need hospital admission, who will get a severe fever, severe temperature, and a further small group, that's an even smaller group, who will need specialized care, even ITU care. And it's, of course, the serious group. And although we tend to say it's in the older women, or tend to say it's in older people, and men more than women for that matter, it is by no means impossible to get a case like this midwife, who was in her 50s, by the way, who did get it in a very severe fashion, leading to lung fibrosis and multi-system organ failure. So the long and the short of it is, we have to practice social distance rules. Pregnant women are regarded as a vulnerable group. They've got to stay inside, stay at home, please. The only way we can beat this virus currently, until the vaccines are available, is to stay at home. And I'm a strong believer that staying at home, unless having to go out for the bare essentials, like one member from the household going out for shopping, should be enforced now that we're at this stage of the game. We don't want to alarm people out there, because I think the cases are still low, but in order for us to not only keep them low, but to actually beat and stop this virus, people have to stay home and only go out if it's absolutely essential. Just follow the directives from our Director of Public Superintendency of Public Health. But staying at home, I think, has got to be enforced a bit more rigorously, particularly if you are pregnant.
Thank you very much, Professor Brincat. Thank you very much for joining us today. That was